contractor is licensed.
February is American Heart Month, and a great time to remind people sometimes heart problems can be mistaken for other diseases.
That's right. You may think you're slowing down because of your age, but heart valve problems like aortic stenosis can be serious and should be treated early. I spoke with Dr. Srini Iyengar from Boulder Community Health about some new treatment options. Tell me, what is aortic stenosis?
Aortic stenosis is basically a calcification or tightening of the aortic valve in the heart. It's the valve that connects the heart to the rest of the body, basically. And that valve, when it does get tight, can result in shortness of breath, lightheadedness, or chest pain. And these symptoms, if they're not treated, can often lead to heart failure. I often tell patients, if you say to me that you can't go to the grocery store or walk up that hill or take the stairs because you get fatigued or shortness of breath, it's not necessarily your age. It could be your valve.
But what's really important that we want to talk about is how much has changed in terms of treating this. And when it comes to surgery, there are some newer and better options. Is that right?
Absolutely. And that's why we're here today to talk about this, because 5 years ago, realistically, in this country, all we had was open heart surgery to treat patients with severe aortic stenosis. Now there's a procedure called TAVR, transcatheter aortic valve replacement. This procedure actually can be done via the groin, actually an artery in the leg or an artery in the arm, as opposed to opening the chest. And we can replace that old valve with a brand new valve, usually within an hour's time, and have the patient home within 1 to 2 days. Now, this is not reserved for every patient. It's only for the patients who are intermediate or high risk for open heart surgery. And we actually have some of the actual models here to show you.
It doesn't start like this, right?
It does not. So everyone home, don't worry. It doesn't go in like this. So this valve actually is crimped on a sheath, and it's much smaller. Once this goes through the artery, it actually gets unfurled in the valve itself and expands to the size that you see right now that I'm holding. So this new valve will actually go in there, and the leaflets, as we can see right inside, start opening under pressure. So there's no mechanics of trying to have those valves open. They will open under the pressure of the own heart, and that's how the valve works immediately.
So you should talk to your doctor about whether you're a candidate for this TAVR procedure. It's great for people who aren't good candidates for open heart surgery. The book